and that a new community-based health center with an emergency room would be opening on Sanford Boulevard. Unfortunately, prior to that, Montefiore failed to have community meetings with the community to inform us of this, to educate us on the process, and to let us know what these steps would be. And that's one of their requirements. So that's really, really a good thing for us. We have to understand that, I'm going to step back for a second. There are so many people that have said, well, why do we care whether or not the hospital stays open? The hospital's in bad shape. They've disinvested or they've divested in the hospital, and so there are no services left there. Well, you need to understand that that's been by design. That's been by design. And we see it not only with our hospital, but when you look across the country and you see many urban communities that went down, and what happened? We moved out, and then they renovated and they revitalized those communities, and then other people moved in and we could no longer afford to live in our communities. It's just as simple as that. And so Mount Vernon Hospital, since the late 90s, they've been disinvesting. They've pulled services out, from pediatric services to OBGYN to labor and delivery to some of our heart and specialty care to our wound center. They've continued to take critical programming out. That really is the programming that pays the bills. Now, what they left there were the services that would not cause the hospital any risk because they're paid for by Medicaid and Medicare. So they left mental health services, they left HIV services, they left substance abuse services, and then they brought in the New York State Department of Corrections unit for the jails throughout the region to use to provide critical care to those who are incarcerated. And so what happened is so many people in the community said, well, I don't want that, and I don't want to go to a glorified community clinic. I really want a hospital. I want a hospital that's providing the services that I need, and that's providing them in a level of quality that I feel as a Mount Vernon resident that I deserve. I just want to show a sign of hands. How many of you use either White Plains, New Rochelle, St. John's or St. Joseph's Hospital, or Bronx Montefiore? How many of you in the room? If you could raise your hand. So it's not that we are not using the Montefiore health system. We are using the Montefiore health system where we feel that Montefiore has invested and are providing quality services. So we have not said to Montefiore that we're not interested in you providing services. We're just saying we're not interested in the services and the level of care that you're providing us in this community. And so we have exercised our options and we are using your system in other places. And so for that, we are now being punished. For that, we're now being told that we are not using Mount Vernon Hospital and that it's our fault that the hospital is closing because those of us who use private insurance, or those of us who have Medicaid and Medicare and different ways of paying for our medical services, that we're not using it. No, we're just not using that location. And we're not using that location because they have taken too many services out. They've cut down the staff. So the staff is overwhelmed, they're overburdened. It makes it very difficult for them to provide the level of care that they're trained to do. They're not hiring bad nurses and bad doctors, they're just not providing them with the tools that they need to do their job and the level of staffing that they need. Because I would think that the same hiring requirements at Mount Vernon Monte are the same hiring requirements that they have at other hospitals, but you can hire the same people, but if you don't give them tools and equipment to do their job, then they're not going to be able to adequately diagnose people, they're not going to be able to serve you at the same quality level, and they're not going to be able to serve you with, the same quick response that they're doing in other locations. And we have to look at that. All of that is intentional. But one problem that we have is we've become emotional and say, well, I don't use it, it can go away. Well, I'm going to tell you, we're not fighting for Mount Vernon to stay open and provide the level of services they're providing now. We're looking for Mount Vernon to stay open and provide the level of services that they're providing in White Plains, in New Rochelle, at St. Joseph's, at St. John's, and in the Bronx. So I want you to be really, really clear. We're not fighting to keep an institution open that is providing us substandard care. We are fighting to keep an institution open so that we can get the level of care that our community deserves. That's the first point. The second point I want you to understand, and please, if you don't understand anything else tonight, understand this. If Mount Vernon Montefiore closes, and they give up the certificate of operations that allows us to have a full-service hospital in the city of Mount Vernon, we lose any hospital options for what, a year, 5 years, forever. Be clear, forever. So if Montefiore Mount Vernon closes that hospital and we allow the state to give them a certificate of need to shut down our hospital and give up their certificate of operations, there is no option for NYU, Columbia Pres, Northwell Healthcare Systems, or any other Westchester Medical Center. None of those hospitals will be able to come in and provide medical services in our community or open up a hospital. Why? Because we have now lost our certificate of operations. Does that really, really help you understand the critical nature of this? Yeah. So we could have, if they give it, and why would people do that? Because they're not going to want anyone to come in and provide competition. They want to control and own the zip codes of 105, 50, 51, 52, and 53. Why? Because we have some of the serious and most persistent and chronic health issues, not only in the state, but in the country. And that means money. So the $45 million that Monty is looking to invest in the Sanford Boulevard system, in that facility, it is not Montefiore's private money. It is New York State money, funds that are coming from the taxpayers. That's us. And they're able to get that type of money because of our statistics, because of our chronic disease rates, because of our medical health complications, because of our poverty rates,